What exactly can cause pain and hurt in our knee? A Baker's cyst, for example, is a kind of swelling that can cause you pain. This may indicate that there is trauma to the lateral ligament. The same pain does not always mean the same diagnosis. You can carefully palpate along this specific ligament and feel that it causes pain. Accordingly, the problem is in this ligament. That's why you always need to get an X-ray to understand the diagnosis precisely. Inside the human knee joint, there are two crucial ligaments that form a kind of cross. Accordingly, the injury may be in the kneecap itself. If you feel pain here, we will now proceed with the following exercise. So friends, hello everyone. As always, we are on the Healthy Hands channel. My name is Maksym Mamchur. I am a physical therapist and I am also the co-founder of the Kinesiotherapy Center network, Healthy Hands. And today we will talk about a rather interesting topic. What exactly can hurt in our knee? As you know, there are many different structures in the knee, and the same pain does not always mean the same diagnosis. So today I will tell you where, how, when, and during which movement something in our knee might bother us, and accordingly which exercises to do in each case. And don't switch away, subscribe to the channel. Let's get started. So the very first thing we have is if we feel pain right in this specific area. I've clearly marked it as number 1. This may strongly indicate that we have an injury to the lateral ligament. Accordingly, this particular ligament might be causing us significant discomfort. Second, if you feel pain behind the knee somewhere around this specific area, or perhaps even here, it could very well be a Baker's cyst. Accordingly, this is a kind of swelling that can cause you considerable pain. Third, inside the knee joint, there are so-called shock-absorbing pads, specifically the menisci. If you experience persistent pain somewhere around this particular area, and especially when you walk or bend your leg, it could very well indicate an injury to these crucial menisci. Furthermore, it can also be a significant indicator that osteoarthritis is gradually developing. Pain inside roughly in this area. It may be more on the right or more on the left. Next, if we feel pain roughly in this area, see, this is the kneecap or patella in everyday language. If we feel pain in it, accordingly, it could be a direct injury to the kneecap itself or osteoarthritis of this particular joint. And as a result, the pain will be roughly in this specific area, somewhere inside, directly under the kneecap. Next, our kneecap is covered on top by a ligament called the patellar ligament. If you can directly palpate this ligament and feel that it hurts, then the problem is in this ligament. And today I will show exercises that can help you get rid of all of this. Next, if the pain is approximately located in this specific area, it typically means that the inner collateral ligament of our knee joint is significantly inflamed, and the cruciate ligaments. Inside the knee, there are two such ligaments that form a kind of cross, the anterior as well as the posterior. Accordingly, these ligaments are responsible for keeping the knee stable and preventing it from moving forward and backward. Today we will test them, see how to notice if they are the ones causing trouble, and do exercises for them. Don't switch away just yet. Let's now then move on to the exercises. So let's test the lateral ligament. I take the patient's leg and gently stabilize it. I then place my hand on the inside of the knee, carefully keeping the knee straight, and at the same time I try to bend it sideways, specifically in the lateral plane. And accordingly, the patient tells me whether it hurts here or not. If pain occurs here, we move on to the next exercise. So we sit in this position, attach a resistance band to the leg, fix the other end of the band to our sofa, and on the exhale, simply move the leg out to the side. In this way, the lateral ligament is engaged. You can do 15, 20, or even 25 repetitions like this, exhaling with each movement to the side. Why do I suggest exhaling? So that you don't excessively strain and to significantly reduce overall tension, thereby effectively lowering your entire blood pressure during the physical exercise. Because if you do strain or attempt to help yourself by straining, your blood pressure may indeed spike quite dramatically. We absolutely need to carefully control our blood pressure and finish our exercises in a truly good mood and feeling exceptionally well. You can perform 2 or 3 complete sets of 25 repetitions each. The inner ligament. In precisely the same manner, I carefully take the patient's leg, gently press here against the knee joint, and from this position I then slowly pull the heel towards myself. It visually appears like this: 1, 2. If the patient experiences any significant pain here, we will immediately move on to the next exercise in our sequence. Sitting in precisely the same position, now we gently bring the leg inward. 1, then return to the starting position. 2, then return, 3, then return. We perform this exercise in exactly the same way, exhaling smoothly as we pull the leg inward towards our body. Do 20 to 25 repetitions of this particular exercise, and accordingly, you can effectively complete 2 or 3 full rounds of these beneficial exercises. So let's discuss a few next important conditions. They tend to recover quite well thanks to a single focused exercise. What is this exercise? I'll show you now, but first let's palpate and test. Visually, if I carefully run my hands over the knee like this from above and feel a distinct pain, for example, in the patellar ligament itself, then the injury may very well be located there. If we feel a noticeable pain when we gently palpate the kneecap, which is also known as the patella, then the injury may indeed be in the patella itself. But I remind you, it is always absolutely necessary to get an X-ray in order to accurately understand the diagnosis. Next, knee osteoarthritis and meniscus injury. We lie down completely on our stomach, just like this, and then we ask someone to gently press on our knee and carefully rotate the leg within the knee joint. No, not the ankle itself, but specifically and precisely the knee joint. If we feel pain in it, accordingly, it could be a meniscus injury or even osteoarthritis. With this overall set of symptoms, which exercise should we use? Show us. So meniscus injury, knee joint osteoarthritis, patella osteoarthritis, pain and inflammation of the patella ligament. Friends, the next exercise will be relevant for this set of issues. What do? We typically sit down either comfortably on a sturdy bench or on our own bed, then carefully place a soft roller directly under the knee, and subsequently extend the leg at the knee joint. Perform approximately 15, 20, or even 25 repetitions depending entirely on your current physical condition and comfort level. How exactly does this particular exercise help? A large group of muscles, namely the front thigh muscles, are actively engaged, which significantly improves the overall nourishment of the knee joint itself, speeds up the healing of the injury, and strengthens the quadriceps, the front part of the thigh. As a beneficial result, it will effectively help absorb considerable shock and withstand the substantial loads on the knee joint caused by your body weight. So 25 repetitions, you can comfortably do 3 complete sets and then rest adequately afterwards. Next, first, in the image, we clearly see a Baker's cyst, and also when we carefully palpate, when we gently touch under the knee like this, we can feel a noticeable bulge. This is a Baker's cyst. Let me show you a very effective exercise to work directly with this specific problematic cyst. If it's a Baker's cyst, our primary goal is to effectively get blood flowing through this specific area and significantly reduce its overall size. How are we going to do this? Bend your leg gently at the knee. Return to the starting position. Do not push into any sharp or intense pain, and certainly do not bend your leg so much that the Baker's cyst could potentially burst. Instead, just perform about 25 gentle repetitions like this, completing 3 full sets. When you carefully bend your leg, remember to exhale slowly and accordingly. With a persistent Baker's cyst, it is generally necessary to diligently work on it for at least 2 full months for it to significantly decrease in size and alleviate discomfort. So, the cruciate ligament, which is inside, stabilizes the knee. If we sit in this position, take our leg and move it at the knee joint, we can see that there is play in the knee joint. If the play goes forward, it means trauma to the anterior cruciate ligament. If the play goes backward, it means trauma to the posterior cruciate ligament. If there is a complete tear, surgery is necessary. If there is a partial tear, I will show you which exercises you need to do to train your knee. So, if our cruciate ligaments are injured, not torn, just injured, our task is to strengthen them. Since they are stabilizers of the knee, we need to do squats on unstable surfaces. In our case, this is a half sphere like this. You can find something quite similar for yourself, perhaps even consider buying it at a well-stocked sporting goods store, and you can certainly hold on to a sturdy wall if it feels really difficult or challenging. If you are more physically prepared and have a good level of fitness, then you can perform squats on unstable surfaces without needing to hold on to anything. Do 20 to 25 repetitions on one leg. Accordingly, you can initially start with both legs, and if that becomes too easy or comfortable, then proceed to do squats on a single leg. You can aim for 3 complete sets. So friends, I really hope this was useful for you. Now you know that the knee is quite a very complex structure and joint. Please let me know in the comments how useful this was, how you did the exercises, and if something didn't work out for you. Let me know about it. Subscribe to our channel. I truly hope there will always be even more useful content ahead. Stay healthy and well.